Good evening, everyone, and I'm Krishnamurthi Kannan. I'm going to speak on the environmental health, current challenges, and future directions. Uh, excuse me. Environmental health. Environmental health is the branch of public health that focuses on the interrelationships between people and their environment. It promotes human health and well-being and fosters healthy and safe communities. As a fundamental component of a comprehensive public health system, the environmental health works to advance policies and programs to reduce chemical and other environmental exposures in air, water, soil, and food, to protect residents and provide communities with healthier environments. And on the definition part of the environmental health is the science and practice of preventing human injury and illness and promoting well-being by identifying and evaluating environmental sources and hazardous agents and limiting exposures to hazardous physical, chemical, and biological agents in the environment components such as air, water, soil, food, and other media or settings that may adversely affect human health. The air pollution part, air pollution of 1.6 million deaths in India, accounting for 17.8% of total deaths. And the majority of these deaths were from ambient particulate matter pollution, which is about 0.98 million. And household, that is indoor air pollution, accounts for 0.61 million. The air pollution is an environmental exposure that affects millions of people. In 1 year, approximately 3.5 million deaths were attributed for indoor air pollution and 3.1 million for the ambient air pollution. And also disability adjusted life years are a global metric used to measure the overall disease burden by numbers of last years, active years due to ill health and disability or even early death. For air pollution exposure, there were 4.3% DALIs for indoor air pollution and 3.1% DALIs for ambient air pollution calculated in the same 1 year time period. There are 3,000 cities in 103 countries that measure air pollution levels exceeding the recommended quality guidelines. And in these areas, there are more respiratory based illnesses. Thus, individuals living in urban cities are more likely to suffer from these diseases simply by the location of their residence. And in water pollution, annually more than 1.5 million Indian children die from diarrhea in India, and because of the poor infrastructure and absence of sewage control. And approximately 38 million Indians suffer from waterborne diseases each year due to typhoid, cholera, and hepatitis. And environmental factors that affect human health, like exposure to hazardous substances in the air, water, soil, and food environment. Then the natural and technological disasters that occurs like accidents and recently the styrene gas leakage occurred. So similar kind of accidents occur, so that will be a disastrous one. And of course, climate change, that plays a major role. And apart from climate change, there are occupational hazard and the built-in environment that also plays a role in environmental health. Then health effects of pollution, like air pollution. Suppose if we consider CO emanated from the industry, so that CO causes headache, fatigue, and also the respiratory illnesses. Then the lead exposure, lead causes nerve damages. Then volatile organic compounds causes cancer risk, then nausea, then skin irritation. Then pesticides from industries due to soil contamination, so affects headache, fatigue, excuse me, gastroenteritis, then nausea. And some water pollution, bacterial contaminations, parasites, and chemicals also cause gastroenteritis. So these are some of the major illnesses caused by the pollution. The health risk assessment. The health risk assessment is one of the most widely used screening tools in the field of health promotion and is often the first step in multi-component health promotion programs. It is an instrument used to collect health information, typically coupled with a process that includes biometric testing to assess an individual's health status Then risks and habits alone, the HRA can do little to improve health or cut costs of expenditure. But as part of a broader program to engage employees in their health, shape lifestyle choices, and promote prevention, and this health risk assessment can be enormously effective when we combine this with other factors. Then complexity of integrated exposure assessment. So exposure assessment normally done using experimental and computational. The experimental will contain the environmental monitoring, personal monitoring, and biomonitoring. And the other computational one will use far field exposure models, near field exposure models, then dynamic models. Then in dynamic models, it will have pharmacokinetic as well as reverse toxicokinetic models. So these are some of the tools used for the exposure assessment. Then in our NEERI, we conduct environmental health research on research for development and validation of biomarkers for health risk assessment. Then we are working with the government for environmental regulations, and we do work with health professionals for identifying the cause of mortality and morbidity due to environmental factors. And we also do studies with the industries and for the industries on occupational health and safety and as well as health risk assessment. Then there are some of the studies published literature at NEERI. The one study published in the health burden and economic costs averted by ambient PM 2.5 pollution reductions in Nagpur. So this study was done along with the Air Pollution Control Division. So you can see the authors. Dr. Rao, Padma Rao, Madam is also there. Then in another study, increased average annual prevalence of upper respiratory tract infection in the central Indian population residing the coal-powered thermal power plants nearby Nagpur. So this was published in the recent one. This is published in the January issue of 2020. Then third one, the gains in life expectancy by ambient PM 2.5 pollution reductions in localities of Nigeria. So where Dr. H. Tunde, he had done his PhD with in NEERI. So therefore, we have a collaborative study with Nigeria also. Then, and the fourth one, assessment of occupational exposure to diesel particulate matter through evaluation of 1 nitropyrin and 1 aminopyrin in surface coal miners in India. So this study I'm going to explain further. Next slide. Connections between IRIS assessments and risk assessment and risk management. Like hazard, this approach requires initial identification of hazard. So which health outcomes are credibly associated with the agent. Then next comes the dose response assessment. This is characterization of exposure response relationships between the xenobiotic, that is chemical or any agent, and the humans. Then account for high to low dose animal to human and root to root and other differences. Then exposure assessment also does by accounting people come in contact with this and other agents. Then how much are they exposed to it, the quantification part. Then comes the risk characterization. So this is being done integrate hazard, dose response and exposure. So all three together. Then comes the risk management. Develop, analyze, compare options, select appropriate response. Then other considerations also are there: legal, political, social, economic, and technical issues. So IRIS assessments evaluate only human health hazards and do not address the legal, political, socio-economic, or technical considerations involved in risk management. So which we used to study in other parts also. So in another study, like when we did with WCL, emission inventory of the study area nearby Nagpur, we did. So we have chosen 4 open cast mines from in the area of Durgapur, Umred region, Mongoli, and Gondegam. So all they are having similar dust generations pattern. And the air monitoring we did using the cascade impactor, and the sizes are from 0.25, 0.51, and 2.5. And we did GCMS profile of nitropyrin and PAH in the Gondegam mines. That is the nitropyrin present in the nitro-PAH. The vehicles being used in the mines are majorly using diesel. So diesel means, so it will generate nitro PAHs, nitro aromatic, polycyclic aromatic hydrocarbons. So nitropyrin present in the air we have measured. So this shows the peak of nitropyrin, one nitropyrin, and also we got other than nitropyrin, perilene, benzoypyrin, etc. Then we assessed the sites wise. There are one nitropyrin, benzoypyrin, fluoranthin, nitrofluoranthin, then acetylpyrin, then benzoypyrin, difluoroacetamide, then fluoranthin, nitro derivative. So these are the various pH compounds present in the mines. Then we measured particulate matter. Sampling and analytical protocol used in the study are for PM10, PM2.5, organic and elemental carbon. So the sampling instrument used for PM10 2.5 were fine dust sampler. For OCEC, particulate collected on quartz filter. Then sampling frequency 1 week for all the three, and period also same. Analytical instrument were different, like electronic microbalance was used for PM10 and 2.5, whereas for OCEC we used DRI model 2001 thermal and optical carbon analyzer. The method separation impaction gravimetric for PM10 2.5 and improved thermal optical reflectance TOR protocol. Then for minimum detectable limit for PM10 and 2.5 were 5 microgram per cubic meter, whereas OCEC 0.33 and 0.25 microgram per cubic meter respectively. Then the particulate matter concentration and the ratio of PM10 and 2.5 measured. The average PM 2.5, 10 and the ratio of PM10 and 2.5 were measured, and we got PM 2.5 were 77 to 89 microgram per cubic meter of these three areas. Then similarly PM 210, 222 to 249, and the ratio was 0.35 to 0.38. And health studies, where we studied the by collection of secondary health data, primary health survey, then biomonitoring studies. The secondary health was collected from the WCL hospitals for various diseases. Then for primary health survey, we contacted the persons and took personal interview for health perception. Then for biomonitoring, we collected urine samples for metabolites, for exposure marker and response marker. So these are some of the hospital data showing the prevalence of diseases. So total persons screened for the year with respect to year, then the prevalence of diseases, cancer, diabetes, hypertension, ischemic heart disease, and the COPD was prevalent in Mongolia and Gondegam. Hypertension, diabetes, ischemic heart disease, and cancer were prevalent. And similarly for Durgapur, cancer, diabetes, hypertension, ischemic heart disease, and COPD. And increasing trend of prevalent disease in mine was observed. So from 2014 to 2018, if you see, so there is a slight increase in the blue band, which is COPD. You can see, and the purple one is ischemic heart disease, and also the green one, hypertension. So these three diseases were increasing as the years are advancing. And these are primary health data collection sample copy I pasted here. And biomonitoring of exposure risk. So we measured nitropyrin, one nitropyrin in air sample, and its metabolite in urine sample as one aminopyrin we measured. So you can see the risk of respiratory illness due to PM 2.5 exposure. So this is unadjusted odds ratio, and this is adjusted odds ratio with age, BMI, industry pollution, vehicular traffic, and behavioral habits. So not much variation is there. Whereas risk of skin irritation. Hello. So risk of skin irritation and eye irritation due to PM 2.5 we measured, And apart from this, box plot showing PM2.5 exposure profiles to workers with and without disorder. At Durgapur site, there was slight significance in skin problem was observed in with respect to PM2.5 concentration, and others are not having much significance. So this is HPLC analysis of 1-aminopyrin in urine samples. This is the method we used, and these are the findings. We got the data. The marker that is Umred and Durgapur, Mongoli, and Gondegaon. Gondegaon, mine was the highest availability of presence of aminopyrin was observed, and that was the exposure biomarker. So this is 8-hydroxy-deoxyguanosine. So this is a marker for effect biomarker. So the 1-aminopyrin causes damage in the cells. So that creates the 8-hydroxy-deoxyguanosine. So which is an indicator of effect biomarker. So we found the more level of 8-hydroxy-deoxyguanosine at Gondegaon mines, and correlation of diesel particulate matter exposure with the health status. So this demographic marker and behavioral characteristics of workers. So we found the p-values in age, as they are in age, older people are having more risk, and similarly the 8-hydroxy-deoxyguanosine level, that is effect biomarker, whereas the DNA damage marker. So that is also showing the risk. So this was obtained using one-way ANOVA Pearson's chi-square test. So you can see the effect of 1-nitropyrin level on 1-aminopyrin level in urine sample after adjusting with the age, BMI, and behavior. So you can see the p-value here, nitropyrin having 0.0137, and similarly here 0.0026. So highly significant level, overall level, it is significant showing. So Durgapur site, 1-aminopyrin level was positively related with the 1-nitropyrin level as indicated by the coefficient of 0.06 and 0.047. That is p less than 0.000137. The overall analysis across sites revealed statistically significant effect of 1-nitropyrin concentration on 1-aminopyrin levels. Means these were metabolized. The 1-nitropyrin was metabolized into the form of 1-aminopyrin, and this was after adjusting with the age, BMI, and behavioral attributes. This scatter plot showing relationship between 8-hydroxy-deoxyguanosine, that is effect biomarker, and the exposure biomarker, aminopyrin. You can see the overall data across all the sites showed statistically significant correlation between the two markers, that is aminopyrin and 8-hydroxy-deoxyguanosine. The p value was 0.007. Salient findings and summary. The air quality at various locations of 4 mines. Umrer mine exceeded average PM10 values of 378, 362, and while the prescribed limit for mines after year 2000 is the 250 microgram per cubic meter. So whereas these are higher than the 250. So all 3 locations of Mongoli mine showed more than 2-fold increase in average PM10 concentration than the standard limit. And the ratio of PM10 and 2.5 at monitoring locations. So particulate matter concentration at all the 4 mining area have exceeded the limit, and the maximum concentration of PM was observed at Mongoli open cast mining, and Durgapur open cast mining area and Gondegaon area showed comparatively higher values for the ratio, and this ratio signifies the amount of dust emanating from combustion activity. And the overall risk, health risk diagram shows there is prevalent diseases of 4 mines during 2014 to 18, and the 8-hydroxy-deoxyguanosine, that is effect biomarker, was significantly higher at Gondegaon, that is p less than 0.001, and 3 mines showed higher level in ischemic heart disease and COPD. And in another finding, 1-nitropyrin and 8-hydroxy-deoxyguanosine correlation was insignificant in all the 4 mines. And the questionnaire survey of showed the respiratory diseases 12.6% and eye irritation 18% and skin irritation 6.5 and over of all the 4 months, and no cancer was reported. And the 1-nitropyrin exposure biomarker increase in all sites of 4 months at Mongolia is higher. Then 1-nitropyrin and aminopyrin correlation with BMI and behavior where weak coefficient was obtained. And the challenges in prediction of environmental exposure and health risk assessment. So there are current challenges on environmental health, like non-availability of health data, then integrated health effects prediction system. Similarly, what I mentioned earlier, with legal aspects, with the other review aspects. So there are many aspects to be incorporated in the health risk assessment. Then disaster response and management. So here in India, we are lacking the what shall we say, like we are taking everything in a reactive approach, not an active approach. So we need to have active approach towards the environmental management. And also on training part on environmental health, so we need training on of personals with respect to other than their area. Suppose the person working on environmental monitoring, so he need to get training on the exposure assessment similarly. Then non-availability of reference dose for exposure to pollutants and non-availability of baseline data and gaps in epidemiologic studies. So I'll give the examples like non-availability of health data. So there are scanty to limited data available with respect to environmental health. There is no doubt that healthcare data saves lives. And this was the courtesy of Pathania and non-availability of reference dose. So there are no exposure standards available in India with respect to nanomaterials, endocrine disruptors, and PCPs, then bioaerosols and microplastics, etc. And similarly, the reference dose should be no observed adverse effect level. That is the criteria to be followed. Then gaps in epidemiological studies. So there are gaps like hazard coefficient is there. So it will interpretation and comparison of results. So it will directly do that. Whereas other approaches will use deterministic approach, probabilistic approach, then non-carcinogenic human health risk assessment due to intake of fluoride and nitrate. There are examples in containing water. Then intake of fluoride and nitrate containing groundwater. And these to be incorporated, then only the risk assessment can be done. So that will be a realistic approach. And that will be sensitivity analysis and multivariate analysis also to be taken into consideration. And similarly, disaster response and management. So there are 2 incidences where Bhopal gas tragedy in 1984. So that was caused due to methyl isocyanate emission. Similarly, styrene gas leak at Vizag in the year 2020. So these are valuing economic loss due to environmental disasters. So these need to be focused, and earlier, like disaster management cell need to be there at every organization. So we have in place, which is being looked after by Dr. Padmaram, Madam herself. Then integrated health effects prediction system. Like integrated health effects prediction system is needed for environmental health application for the disease outbreaks of environmental origin, like airborne, waterborne, infectious diseases. So this would have been useful when the COVID-19 corona case occurred. So this kind of system, if in place, so that will take care of the either arrest the spread of the disease or the prevent the disease occurrence. So that way it should be working in hand with other experts. Like environmental health professionals can intervene and prevent such outbreaks. So if they work together with other departments, so that problem can be averted. So in the case of training needs on environmental health, the topic is interdisciplinary and to transdisciplinary. The new content areas required are informatics, genomics, communication, cultural competency, and community-based participatory research, as well as global health, policy and law, and as well as ethics. So these many things are required for development of an integrated health risk assessment. And the develop systems of accountability, wherein the availability of quality health data, access to health data, and commitment through resource mobilization and task initiation, quality of service, and task completion achieving targets can be done with the help of community as well as health service providers and the management, using the action like information sharing as well as they are taking action and by sharing the accountability. So these things should be integrated so that the approach can be valuable and useful. And similarly, evidence-based policy and practice requires the evaluation of program and policy, then community assessment, then qualifying an issue. Like any issue can be taken up, like the major incidents, like styrene gas leak incidents, if we consider, though the qualifying issue is the gas leak and how that occurred, and on what are the factors involved, in the gas leak, and that everything we need to decipher in a systematic approach, and also developing concise issue statements. So based on the findings, though the statements can be issued, whether the industry per se was involved, or there was negligence involved, or the deliberate. So these things can be elaborated. Then the searching the scientific literature. This literature survey is very much essential for any study, and that too for health risk assessment we need to have robust search engine, and also the developing programs or policy options. So there need to be policy revamp, okay, and development of action plan and implementation. So the policies revamps will lead to development of action plan and implementation. One Health, the communication environment, that is One Health. One Health is an approach that recognizes that the health of people is closely connected to the health of animals and our shared environment. The One Health has become more important in recent years. This is because many factors have changed interactions between people, animals, plants, and our environment. Human populations are growing and expanding. As a result, more people live in close contact with wild and domestic animals. Animals play an important role in our lives, whether for food, fiber, livelihoods, travel, sport, education, or companionship. The movement of people, animals, and animal products has increased from international travel and trade. So as a result, diseases can spread quickly across borders and around the globe. One classic example is COVID-19 pandemic. Since we live in close contact with animals and their environments, provide more opportunities for diseases to pass between animals and people. The major One Health issues are zoonotic diseases, antimicrobial resistance, food safety and security, vector-borne diseases, environmental contamination, and other health threats shared by people, animals, and the environment. So people who protect human, animal, and environmental health and other partners. So they are playing a major role in here, coordinating, communicating, and collaborating, and as well as achieving the best health outcomes for people and animal, and as well as our environment. The future directions for environmental health. See, we need to adopt a population level approach. So far, the approaches are being done using the external factors. not involving the population who are dwelling or who are going to get affected. So those kind of things can be avoided, and this involvement of population is must in the integrated approach. And the strengthen the government and public health infrastructure by the developing the newer softwares and other systems in place, and then communication enhancement using the dissemination tool. And based on these dissemination tools, can evidence-based policy and practice can be formalized or formulated, and this will build a partnerships like accordingly. So if we have in place the good communication system and the health infrastructure, then evidence-based policy and practice, so this will definitely develop systems of accountability. So here accountability is most important. Because of non-accountability, people are taking it lightly and not seriously. So that is why the most of the incidences like disasters and the leaks and other things are also happening because of non-accountability. So that needs to be worked out. And preventive measures for achieving sustainable environment and health. So preventive measures are most important. So even if we have policies or infrastructure, everything in place, the effective management is not there, then the system will get failed. So that way, environmental sustainability requires preventive measures like shift to renewable resources, limiting consumption of non-renewable resources. So as we are, India is going ahead, and as well as the world is gearing for more usage of renewable resources and avoiding the non-renewable resources. So that way the approach is good. And similarly, generational decisions, like make economic decisions based on long-term consequences. So we need to address the short-term measures only. We need, like we take decisions based on the immediate protection or immediate benefits. So that way it should be not considered. It should be considered for the long term. So maybe for 10, 20 years down the line, or 50 to 100 years down the line. So what will be the scenario? How the decision can affect with quality improvement or the quality deterioration. So that way we need to use our approach. Then protect health of ecosystems, like avoid ecosystems becoming irreparably damaged. So similarly, when we use the renewable resources, so this kind of problem can be solved or avoided. Then avoid excess pollution. Pollution can cause damage to health and the Earth's atmosphere. So this approach needs to be adopted. And similarly, target welfare of global health index, not considering only for global domestic produce. So value measures of social welfare is more than the GDP should be the approach, our approach. So these are the fundamental approach of 5 approaches will lead us to a preventive measures for achieving a sustainable environment and health. With this, I thank the audience and the organizers as well as my collaborators, like Dr. Tapan Chakraborty. So this is tribute to him since he passed away on 14th of February. And Dr. Saravana Devi, my colleague, Dr. Amit Bafna, and Dr. Anirban Midday. He is working on air pollution part, and he is working on microbial. He is a microbiologist and working on microbial aspects and climate change. And Dr. Devi is a geneticist, so he is working on genetics aspects. And then I thank the like DST New Delhi, DBT New Delhi, CSIR New Delhi. Then some of the sponsors of the project, like Hindustan Limited Udaipur, MPCB Mumbai, and WCL Nagpur. Without their financial support, the work could not have been achieved. And I thank the audience and the organizers for giving me this opportunity. And I also request for more number of projects to be taken up on the environmental health part. So with this, I conclude my talk. Thanks.